Assalamualaikum and very good morning everyone. My name is FARADILLAH and my metric number is 2025484364.
Thank you, Amy. My name is ATHIRAH and my metric number is 2025245918.
Today we will be presenting our topic titled The Trend and Stress Distributions of Hand, Foot and Mouth Disease (Hfmd) cases in Malaysia from 2024 to 2025. These presentations will focus on how Hfmd cases change over time and which states were most affected during the year 2025. Now, I will begin with the introductions. Hfmd, or hand, foot, and mouth disease, is a highly contagious infection that commonly affects young children, especially those below 6 years old. This disease spreads very easily through saliva, nasal secretions, fluid from blisters, and contaminated objects such as toys, door handles, or tables. In Malaysia, Hfmd cases usually appear in cycles and tend to increase during the periods when children are more active in social environments such as in preschools or childcare centers. According to the Ministry of Health, Malaysia's 2025, the number of Hfmd cases recorded between 2024 and 2025 showed noticeable fluctuations, with certain weeks experiencing a significant spike in infections. So, in these presentations, we will examine the weekly trends of Hfmd cases and identify the states that contributed the highest number of cases. For the credibility of our informations, earlier this year I read the Epidemiological Bulletin for June 2025 published by the Ministry of Health Malaysia. This bulletin provides official surveillance data for Hfmd cases across all states in Malaysia using the national e-notification system, which collects real-time reports from clinics and hospitals. The bulletin highlighted that states with high population density, especially Selangor, recorded the highest number of infections. Because our data is taken directly from the official MOH publications, the information we present today is accurate, valid, and based on real national health surveillance records. Next, I will pass the presentations to my partner ALIA, who will explain more about the background of Hfmd.
Thank you, Evie. For the background, Hfmd is mainly caused by two viruses, which are Coxsackie A16 and antivirus 17.1. This virus spread quickly among the young children because they often play together, share toys, and may not practice proper hygiene, such as hand washing. Hfmd commonly spreads in a place such as childcare center, preschools, kindergartens, playgrounds, and busy urban area. This is because of this environment have a high interaction and shared surface. In 2025, several states in Malaysia record a high number of Hfmd cases due to the factors such as a population density, urbanization, overcrowded childcare centers, and sometimes inconsistent hygiene practice. Distributions factor helps explain why certain states reported significantly higher infections rates compared to others. Now, I will pass the presentation back to the AV to explain the central ideas and purpose of our topic.
The central idea of our presentations is focused on two aspects. The first one is to describe the weekly trend of Hfmd cases in Malaysia between 2024 and 2025, especially identifying when cases increase or decrease. Next is to identify the top states that recorded the highest number of Hfmd cases in 2025. The purposes of our study are to analyze the weekly pattern of Hfmd cases from epidemiological week 1 until week 26. Next is to present the percentage distributions of cases by state for the 5 states with the highest recorded infections in 2025. Next, I begin first with chart 1, which is a line graph taken from the Epidemiological Bulletin of the Ministry of Health Malaysia. This graph shows the weekly number of Hfmd cases in Malaysia from week 1 until week 26, and it compares 2 years between 2024 and 2025. On the graph, the blue line represents 2024, while the red line represents 2025. First, if we look at the blue line for 2024, we can see that the trend remains quite low and stable throughout all 26 weeks. There are small fluctuations, but overall, 2024 did not experience any major spike in Hfmd cases. Now, if we look at the red line for 2025, the pattern is very different. Starting around week 14, the red line begins to rise sharply. This upward trend continues until it reached its peak at week 18, which is the highest point of Hfmd cases for 2025 in this graph. This peak indicates a significant outbreak during that period. After reaching the peak at week 18, the number of cases starts to drop gradually from week 20 until week 23. This shows that the outbreak began to stabilize during this period. However, if we continue looking at the red line, there is a slight increase again around week 25 and week 26. Even though the rise is not as high as the earlier peak, it still indicates that some cases continue to occur towards the end of the observations period. In summary, 2025 shows a strong and noticeable outbreak, while 2024 remains slow and stable. The comparison between the red and blue lines clearly highlights the difference in Hfmd activity between the 2 years. And that is all for chart 1. Now, I will pass the presentations to my partner, ALIA, who will continue with chart 2, which explain the percentage distributions of Hfmd cases by state in 2025. Thank you.
Thank you, Evie. For this slide, we have a pie chart that shows the percentage of Hfmd case by the state of the top 5 states in 2025. Based on the data from the Ministry of Health, Selangor recorded the higher percentage with 55% of all cases, followed by Johor with 16.4%, Perak with 50.5%, Kelantan with 11.8%, and Wilayah Persekutuan Kuala Lumpur and Putrajaya with 11.4%. From this chart, we can clearly see that the Selangor alone account for the almost of all Hfmd cases in Malaysia. This is mainly because of Selangor have a very high population density, many childcare centers, and a lot of movement of people, which make the virus spread more easily. Johor, Perak, Kelantan, and Kuala Lumpur also record the highest percentage due to the similar factors such as crowded urban area and inconsistent hygiene practice in some facilities. In conclusion, Hfmd remain a major public health issue in Malaysia, especially in the state with a high population density. The Ministry of Health should continue strengthening surveillance system, especially for the childcare centers and schools. Taska and preschool should practice the strict hygiene, such as regular sanitizing and health screening. Parents and public also plays an important role by practicing a good hygiene habits and mainly frequent hand washing and avoid sending sick children to the school. Thank you.
That is all from us. Thank you for listening, and we hope our presentations give a clearer understanding of the Hfmd situations. Thank you. Have a nice day.